Hello, my name is Robert Marshall. I'm a paramedic firefighter from the state of Florida. I work for Hillsborough County Fire Rescue. I'm a training officer and quality assurance officer. I teach the paramedics about fireground smoke and recognition of some of the signs and symptoms, and then we go ahead and work on treatment modalities as far as the treatment for CO and a treatment for cyanide, which requires an antidote.
Okay, what are the symptoms of CO or cyanide poisoning?
Now, CO and cyanide kind of overlap each other, so a lot of the symptoms are similar. Some are weakness, some are changes in their mental status, some are changes in blood pressure, changes in heart rate can go up or go down, respiratory rate can go up or go down, and they can lose consciousness. Their blood pressure can become non-existent, and it can cause a person to go into cardiac arrest.
How quickly should a person be treated for for all these symptoms?
Like with any pre-hospital condition or medical condition, you want to be treated as soon as possible. So that's why we're teaching EMTs and paramedics and firefighters how to recognize these signs early so we can get started with the treatment for CO and also give the antidote for the treatment of cyanide.
One other question, what kind of products that burn or burning products or materials would be a danger to a firefighter?
Well, as far as the things that produce CO and cyanide, a lot of household products do that. Anywhere from what we see in homes, plastics, polymers, particle board, the laminates that we have in every kitchen. The wood now is no longer natural wood. It's wood that's pressed with glues, your rugs, your wool, your anything that's man-made as far as the plastics, the drop ceilings, your computer equipment, your TVs, your televisions, all can produce CO and cyanide along with some of the other chemicals like the oxides of nitrogen, formaldehyde, and some of the other stuff that cause cancers in firefighters.
Is there a good recovery rate for a person who's been exposed to those harsh chemicals?
When it comes to CO and cyanide, early recognition and early treatment has a great turnaround. My department has a number of people that have been treated for it. In fact, our first case was one of our firefighters in 2008 who's still on the job today with no side effects.
Is this a one-time treatment for a fire person who's been exposed?
For cyanide and CO, the treatment for CO is oxygen, so that's a one-time therapy as far as that goes. And for the cyanide kit, yes, it's for the initial causes of the treatment of cyanide, initially seeing those changes at that point. After those symptoms, because this is the antidote, after those symptoms has gone away, you don't need to continue treatments.
It's wonderful. Are there any side effects?
Some of the side effects that cause your skin to look red flushed. Your urine will also have that red color because the product itself is red. Also some transient hypertension that lasts about 4 hours.
Which is worse, the CO poisoning or the cyanide poisoning?
When it comes to the body, cyanide is much more toxic than the CO. CO itself has a certain half-life, so just breathing regular air can actually reduce the CO in your bloodstream. The cyanide requires an antidote because if you don't get the antidote, your blood cannot get the oxygen it needs to all the tissues.
Is cyanide a cumulative poison? Whereas if the longer you're exposed to it, the more the level builds higher, or?
I know they're looking at that as far as trends go, but they think that yes, that these trends of being exposed to cyanide over periods of time could trigger heart attacks and other problems.
One last question, and thank you very much. Is this a product that most firefighters should have access to?
Most fire departments should have access to pre-hospital treatment. It is a little bit expensive for some departments, but it is a life-saving intervention. Just like other things we do as far as paramedics go, we have a lot of medications that are life-saving interventions, and this is one of those.
What do you see in the future of the treatment, of the product, and of the problem?
Well, I see the problem is going to continue because we have man-made furniture, man-made equipment, and man-made supplies in everybody's homes. I see the recognition and getting it out to all the firefighters so they're aware of it and trying to limit their exposure. But sometimes accidents happen, so having the treatment readily available in the pre-hospital setting or right there in the hospital where they can get to it very quickly will be very helpful.
Somebody had told me that even items you would think of as being poisonous, like silk and stuff, all have the possibility of putting out cyanide.
Yes, in different percentages, yes. Even a 5-gallon bucket lid, just heating it can release toxic gases.
Thank you very much.
Thank you.
We've learned a lot today.
All right.
Now, is this product on the fire truck or would it be with the paramedic?
Usually, like with our department, we put it on the rescue, the ambulance, with the paramedics, because the firefighters are in fighting the fire. So then the paramedics are the ones treating the firefighters. Like when they come out of the fire, we're recognizing their vital signs, and if they have symptoms, then that's who would implement it and treat it.
The other question?
No, thank you, thank you.
Okay,
I think we got it.
looks like lunch.
Just in time, thank you, thank you.
What are they all lighting
Trying
up
to
for?
find out who's on it.
It's Firehouse Subs,
BMO design.
made by firemen.
Old man tried to get on it.
I don't want him anywhere near it.
I'm gonna tell him have at it.